cause anybody indigestion or anything. Okay. I want to thank you all for coming. We're going to do this in sort of three chunks, three parts. I would like to introduce the topic of the frameworks. How many people are familiar a little bit with the Massachusetts Health Curriculum Frameworks? I'm going to go over that in detail. I'll explain what's happening with the frameworks, a little bit about Maria Talks, because we had a semi-success in getting that defunded. And then I'm going to hand it over to Kathleen Magno, who is from Mass Catholic Conference. She's the office administrator and has done a good bit of work in fighting these issues in the town of Revere. Just a little bit about how I kind of got involved with this. I taught science in the Boston Public Schools for 34 years. I learned everything that I needed to know from that experience, a few things that I didn't want to know. But coincidentally, when I started working in Boston, it was the same year that the federal government began funding contraceptive services for kids in the local neighborhood clinics. And I was kind of a young hippie, fresh out of college, 1971, and I wasn't too crazy about this idea because something instinctively told me that contraceptives for kids was permission, you know. But I was kind of a young teacher. I was teaching biology. These weren't my issues. I had a career to get off the ground. But I began to watch over a period of time that every problem that contraceptives for kids was supposed to solve went in the reverse direction. What ended up happening is that more kids became sexually active, because there were more kids who were sexually active, there were more teen pregnancies. When abortion became legal, abortions went up. STDs shot through the roof in the community where I taught, and the only thing that went down was marriage. The only thing that, and I sort of had a ringside seat. I became an activist in the mid-'80s when the issue of school-based health clinics, or centers they call them, wellness centers, became an issue in the Boston public schools. And again, instinctively I knew that behind the scenes probably abortion was going to be playing a role. So that's when I became an activist and began studying these issues. So let's just go through the Massachusetts Health Curriculum Frameworks. What are the frameworks? Right now, the Massachusetts Health Curriculum Frameworks are the guiding document for all health education in the state. All topics, not just sexuality, but all health education in the state. Right now, they're recommendations, right? Teachers currently have some flexibility in, what they want to teach, how they want to teach it. But of course, during the past few legislative sessions, legislation has been introduced to require that the frameworks be adopted as the document that determines all health education. Wherever you see the word health, you know that sexuality is embedded in it, right? All sexuality education in the public schools. A lot in the frameworks is well thought out if you're talking about nutrition, exercise, drug and alcohol abuse. A lot of that stuff is good, but the portions on sexuality and reproduction are troubling, to say the least. What would the frameworks do? If this became the law in Massachusetts, it would eliminate any choice for parents in local communities to determine what would be taught to their children with respect to sexuality, contraception, and abortion. It would replace traditional moral values with politically correct values. It would contradict the religious, spiritual, and traditional values that parents might wish to impart to their children with respect, to all of these issues. Now, this is the part that every time I put this up on the screen, I say to myself, nobody is going to believe me, right? Nobody is going to believe me. But unfortunately, this is the reality. Students would be taught under the frameworks how to obtain an abortion without parental knowledge. Students would be taught how to obtain contraceptives without parental knowledge. Students would be taught, I want to keep this rated maybe PG, right? But they would be taught behaviors for pregnancy prevention. I'll explain that in a minute. And the acceptability of homosexual behavior, right? That's all in the frameworks. Now, This one, people look at me, and sometimes I think people say to themselves, well, that would never happen in my school, that would never happen with my kids. But unfortunately, these are the objectives. And one of the things that you have to understand about the frameworks is that a lot of it is written in kind of code language. When we first began publicizing what was in the objectives, people said, well, I didn't see the word abortion. I didn't see the words emergency contraception anywhere in the frameworks. And it's all because it's hidden in this language. Objective 4.20, identify resources for treatment of reproductive health problems. Well, that includes pregnancy, right? Objective 4A, this is when they're trying to connect health issues with the law. Identify and explain laws about reproductive services. Well, one of the reproductive services would be abortion. And of course, if you explain the laws, I am convinced that the vast majority of parents in the Commonwealth of Massachusetts really don't know about the judicial bypass. The judicial bypass says is if a pregnant woman less than 18 years of age, she's less than 18, I still think she's a girl. But if a pregnant woman less than 18 years of age elects not to seek the consent of one or both of her parents for an abortion, a judge of the Superior Court Department of the trial court shall, after an appropriate hearing, authorize a physician to perform an abortion. Now, what the frameworks do is really turn the intent of this legislation 180 degrees around. Originally, the idea was a girl would go to her parents and family with the pregnancy as an issue, and the family would resolve what they were going to do about the pregnancy. This would be hard cases. Girl is afraid of abuse or some such things like that. What the frameworks do, though, is turn this law around and make the judicial bypass the norm. Every girl in Massachusetts will now know she can get a secret abortion. That's basically what this does. Similarly with how to get contraceptives, this is objective 4.7. It says, describe the short and long-term consequences of sexually related risk behaviors and identify barriers and supports for making health-enhancing decisions. I've been a teacher long enough to get used to this jargon. I will translate it into English for you in a minute. Determine and role-play steps that improve decision-making, such as whom to consult and information overlooked. Who do you think might be a barrier for making a health-enhancing decision?
Parents.
Parents, right? Supports would be your local clinic, right? Determine and role-play steps that improve decision-making. Who are you going to tell a 13, 14, 15-year-old girl to consult, other than her parents, possibly clergy? Information overlooked. Maybe your parents don't want you to know about birth control. All right, so how to get contraceptives. Similarly, objective 4.9, it has the students report on the policies of various states and countries regarding STIs, or STDs, same thing, STI is sexually transmitted infection, STI prevention among youth. Anytime you have the kids study the law, especially kind of a controversial kind of law, what they end up learning is loopholes. What they end up learning is how the law can work for them. So according to Alan Guttmacher Institute, Massachusetts explicitly allows all minors to consent to contraceptive services. The state funds a program that gives minors access to confidential contraceptive care. So if you explain this law to kids, what you're telling the kids is, we can help you get birth control and nobody needs to know. That's basically what this does. Behaviors for pregnancy prevention. Well, this is the way the objective is written. It says, describe behaviors and methods for pregnancy prevention, including abstinence. Well, don't be fooled by the little including abstinence at the end, because let's see what happens if you take abstinence away. Well, you're left with describe behaviors and methods for pregnancy prevention. Methods presumably is birth control, right? So if you take birth control out of this, what are you describing to the kids? Describe behaviors. They're talking about what's popularly called outer course how to engage in sex without fully doing it, so to speak. That's what, you know, they tell kids things. Some of the books actually suggest the kids take showers together, all kinds of alternative behaviors, oral sex and this sort of thing. The acceptance of premarital sex, and again it says we're going to explain the laws about consensual sexual relationships and reproduction. Basically, we're going to tell the kids if you want to have sex before marriage, if you want to experiment with quote-unquote gay sex, if it's consensual, then it's legal. That's basically what this does. And the acceptance of homosexual behavior. Now, this isn't talking about tolerance and not bullying kids and things like that. From beginning pre-K to grade 5, they're going to have the kids define sexual orientation using correct terminology. Right? If you look at Objective 4.4, one of the things that the kids have to do is write short answers to define the types of sexual orientation. We're talking about kids 5, 6, 7, 8. You're artificially introducing a controversial topic to kids who have absolutely no concept of what this is about. And for the older kids, this would be high school, age 14 and up. Identify possible determinants of sexual orientation and analyze the weight of available research. How many people think they're going to use research from the Family Research Council? Focus on the family?
No.
Right? Okay, and how does a 14-year-old know what research really says what it claims to say? Right? And explain the laws about consensual sexual relationships and reproduction. So in other words, if you want to experiment with alternative lifestyles, you know, they're telling the kids it's okay to do it. Now, also, sometimes I look at what's missing, not so much what the frameworks say, what do the frameworks not say, right? High failure rates of teen contraception. Think we have time to do the activity?
Sure.
Let's do a little fun kind of thing. I'm going to go around the room and I'm going to ask everybody in the room to take a number in order from 1 to 5. All right? Are you going to be 1, 2, 3? You are 4, 5,
6,
1. Modern math. Over here. 2, 3, 4, 5. Ken, you are? 1. No 6 allowed. 2, 3, 4, 5, 1, 2, 3. Okay. This might be a little difficult because people are still eating. Can you put your plates aside for a second and stand up? What we really should be telling young people is that there is no such thing as safe sex, whether it's with regard to disease, or pregnancy, or emotions. That's really what we should be telling kids. Now, I want everybody, remember your number, right? Everybody has to play honest, so remember your number. Because I'm going to show you what we should be doing for kids, instead of telling them, like the website Maria Talks, that condoms are 98% successful. Isn't that right? All right, so you're going to pretend that you've all graduated from Milford High. Your parents are thrilled with you because you know what? You just won a full scholarship to Notre Dame University. They're going to pay for everything. In September, you go out to Indiana, a little orientation. They want to show you where the gym is and the chem lab and the cafeteria, right? And while you're there, you meet and fall in love with the partner of your dreams. You've never felt this way before. Now, let's say you're in a long-term relationship with this person. Well, for heaven's sake, you've been seeing each other for about 3 or 4 weeks. And the question happens, it always will, it's part of our nature, are you going to have sex with this person? And you decide that this feeling of love is so pure and so strong that the answer is yes. But you know that scholarship? You don't want to ruin things with a pregnancy before you're ready for a baby. So you remember what you heard in your high school class about condoms? And you trot down to the drugstore and you get a supply of condoms. Now, what they don't tell young people in a way that is meaningful and real is this. When young people use a condom to prevent a pregnancy, after a year, maybe a year and a half, you know what? 1 out of 5 teenage couples will start a baby anyway. So, no liars. If you have the number 1, you can sit down. You're not pregnant, your girlfriend's not pregnant. I got any guys here. All right? If you have the number 5, be seated. No pregnancy, you won the lottery. All right? If you have the number 3, have a seat. Right? And the winner is. If you have the number 4, you can stay up. 2s, sit down. All right, now, I want you to imagine doing this with a room full of about 100 kids. Then I have the kids think of all the questions they have to ask. Do you believe in abortion? The dads. Somebody's not telling us. Do you believe in abortion or adoption? Will your partner marry you? Can you stay in school? Can you call home, and talk to your parents about this? And should you be tested for AIDS, right? But then I tell the young people this, and this is crucial because they don't tell the kids this. Everyone that you see standing made a condom mistake at the time of the month when a woman has released the egg, right? A couple of days before ovulation, she can, conceive a child once that egg is released. So in other words, if you have a 28-day cycle, there's about 4 or 5 days when pregnancy can occur. But you know what? You can get or give a disease any day, right? Egg or no egg. So if you have the number 1, stand up. You had a condom mistake this year. If you have a number 5, stand up. You had a condom mistake this year. Everybody that you see standing needs to see a doctor because you might have been exposed to AIDS, syphilis, gonorrhea, HPV, and all those 25 or 26 nasty sexually transmitted disease. This is part of the reason why in this country right now, 1 out of 4 American girls has an STD. In the black community, it's 1 out of 2. Massachusetts has the 11th highest abortion rate in the country among teenagers. Now, I don't like to leave anybody out. All of you lucky people who are still seated, you have to remember something. Everybody that you see standing made a mistake during the first year. Some of you are going to make a mistake next year. So that's what we should be telling kids. You can have a seat and thank you for playing. What else is missing from the frameworks? Limits to the effectiveness of condoms in preventing the spread of diseases. Resistance skills for social pressure. Most kids who engage in sex, they do it not because they're in love. They will tell you it's social pressure, boyfriend, girlfriend, or their peers. And the benefits of traditional marriage. Heaven forbid, no pictures of fetal development in the frameworks. Wonder why, right? Wonder why. So let's take a little snapshot of what's going on in Massachusetts public school. 75% of high schools taught 8 key pregnancy, HIV, or other STD prevention topics in a required course. So they're basically talking about birth control. More specifically, 72% are taught how to use a condom, quote unquote, properly. 90% are taught how to access valid and reliable health information, products, or services related to HIV, STDs, and pregnancy. So in other words, 90% of kids are being taught how to access, counseling and pregnancy follow-up, presumably abortion is included. 90% of schools, high schools, have a gay-straight alliance. You're like Humphrey Bogart here. Round up the usual suspects, right? Organizations that support the frameworks. Planned Parenthood, NARAL Pro-Choice Massachusetts, AIDS Action Committee, ACLU, and the Massachusetts Gay and Lesbian Political Caucus. How many of you are familiar with school-based health centers? Right, these are not the nurse's office, all right? It does treat some of the things that in a typical nurse's office, a sore throat, a headache, kid goes down, All right, school-based health centers, though, I think have a bit of an agenda. The Massachusetts Department of Public Health funds 18 agencies that sponsor 30 of these more than 30 of these school-based health centers. They are staffed by nurse practitioners or physician assistants, and look what they can do. They are authorized to prescribe medications, and that would include birth control and the so-called morning after pill. School-based health centers are located mainly in poor and minority communities, but I think the trend is going to be a little bit more universal if there's plenty of money to spend. More and more schools are going to see this sort of thing. And 75% are located in high schools. I mean, what's the matter with these little kids in the elementary schools? Don't they get headaches and sore throats? And why is this in a high school? Because that's what can happen during pregnancy. School-based health centers must offer a range of services that include reproductive health services, birth control, emergency contraceptives, and abortion, family planning health education and services, pregnancy diagnosis and follow-up, not we call home necessarily, but follow-up, and for reproductive health services not provided on site, the school-based health center must arrange provision of such services off-site. Now, presumably here, they're talking about abortion. They're not going to actually do the abortion in the clinic at school. They're going to send the kid out with a referral. School-based health centers are eligible, the question, who pays for this, right? They're eligible for reimbursement under Medicaid and the S-chip. Okay, so we're going to talk about, do parents have any rights? Just two thoughts before I turn this over to my partner in crime. Oh, excuse me, my colleague, Kathy Magno. Two things. Maria Talks was the online version of the frameworks. How many people have visited the website for Maria Talks? Okay, if you have not, I suggest that you do, just to keep yourself informed. And you might want to click on pregnancy and a few of the links, but also, for some of them, be prepared to take a shower afterwards because they describe various sexual practices in pretty explicit language for kids. This was originally, the idea was to get kids to go to Maria Talks to access emergency contraception. That was the basic intent of it. It was developed by the AIDS Action Committee. Notice how many parents of the Commonwealth were consulted, in developing a website for their children about sexuality. Maria Talks right now is no longer being funded by your tax dollars. However, it is still online, and it's being privately funded somehow through the AIDS Action Committee. So kids could still presumably be told about Maria Talks. The kids can also type in a zip code and they'll locate a clinic for these so-called services. So that's kind of an update on Maria Talks. It's a partial victory. We got direct state funding out of it. The other thing, though, and Kathy will say something about this, the other thing is that right now the frameworks are being retooled a little bit. And what I fear is going to be happening is this. Right now, if your school teaches a sexuality education course, let's say it's 3 weeks, and the topic is sexuality, you can take your child out of that course if you object to it. What they're going to do now, the trend, is for wellness classes. In a wellness class, all these controversial topics, right, birth control, abortion, emergency contraception, sexual activity, are going to be embedded in a spectrum of topics. So it's now no longer a sex ed course, it's a wellness course. And because it's not sex ed, guess what you can't do with your kid? Take your kid out. Okay? So Kathy will elaborate, and thank you for listening. I wish I was the bearer of better news.
So, do parents have any rights? Massachusetts Sex Education Law, Chapter 71, Section 32A states, It affirms a parent's rights to oversee and govern their child's education in human sexuality, and the school committee must adopt a formal human sexuality policy. Schools must take all instructional materials for human sexuality and make them available and accessible for parents and guardians to inspect and view. Also, the school must have a written policy ensuring that school officials notify parents or guardians of any curriculum primarily involving sexuality education or issues. And that primarily means that if it's in an assembly or if it's a guest presentation, someone comes to the school or there's workshops, anything that primarily has sexuality education as the mainstay of the topic of being presented. And parents or guardians may exempt their children from any portion of the school's sexuality program through written notice to the school principal. The school shall take care to guarantee as little embarrassment as possible. So it's left upon the parent to opt their child out of this sexuality education program, classroom, workshop, any of the above. So it's an opt-out policy that we're talking about. And there's no penalties for opting your child out. And however, I want to say something too, a little embarrassment is possible. Oftentimes just being opted out of something is an embarrassment to a child, so. Okay, so this here is a little bit of what Linda was talking about when we were talking about wellness programs. This was actually an assignment taken from a wellness program in Westboro High School. And the project was assessing health information essential for maintaining personal health as a lifelong skill and where to go for most accurate information. So the challenge was presented that students be given a topic or a scenario about accessing health information. And they needed to research that information, provide answers to specific questions about the topic, and cite credible sources. So this assignment was given to Group 5 of the Westboro High Wellness Program. So as you can see, it says, your friend Sally confides in you that she is considering becoming sexually active with her boyfriend, but is worried about the risk of becoming pregnant. Sally would like to use birth control, but does not want her parents to find out. And your challenge is to help Sally research the information necessary to answer the questions below, and create a PowerPoint presentation to explain your answers to the class. So this is what this assignment was to entail. Okay, so more about this assignment. What are the symptoms of pregnancy? How would someone verify that they are pregnant? And there to provide the answers for that. And what are the pros and cons of using birth control pills? So this is what this child who received this assignment needed to answer these questions and make available for the class for her presentation or his presentation. And then, what is the law regarding confidentiality and teen access to reproductive health? So once again, it's talking about that law. Linda mentioned in the first half of the presentation about how the judicial bypass law. And they instruct the child, they need to provide resources, so they send them to the Group Monitor on the library website, Minors Contraceptive Access. Okay, so here's the state policy. Massachusetts explicitly allows all minors to consent to services. State funds a statewide program that gives minors access to confidential contraceptive care.
So if the kids go to that website, that's what they're gonna see.
At that on the Group Monitor site. Okay, so still more. So as part of the assignment, they needed to list 3 agencies in Central Mass where people could get services for this problem, and the problem being the pregnancy. Please provide street address and phone numbers for each agency, and explain what services each agency provides. So the person who had this assignment basically is asked to give a list of where you could go for the problem of a pregnancy, unwanted pregnancy. So you can see how they're putting this into the wellness programs. So, and also they were being asked to cite their sources, and you can see what it says there. So that's considered a assignment from a wellness course at Westboro High.
That assignment was 1 out of 6. The others were about diabetes and other health problems.
So they're including it in. Okay, so what are the recommendations? And what can parents do? Be clear with your children about your values, expectations, and the teachings of your faith. That's an obvious one. Utilize the books and programs made available by your church, and there are many of them. Explain to your children the hazards of the messages they may receive from the culture, their friends or school. I love Linda's example with the raising of the hands. I think that's very effective. If you can, impart that somehow onto your children, the risks that they're taking. And keep the lines of communication open with your kids on several topics, including sexuality. And still more. Network with other like-minded parents. We all wouldn't be here today if we weren't networking with people who hold our values dear. And contact your legislators about the content of the mandatory program. So it's very important to find out what's happening on the legislative level. Contact your local reps and senators to see what's happening. Dialogue with school officials about the content of the health and sex ed programs. Make yourself a pest. Make sure that you get the answers that you want. Don't leave until you're happy and satisfied that you've had all of your questions answered. You need to ask them specifically what they will teach about abortion, what they will teach about birth control, what they will teach about premarital sex and marriage, or what they won't teach, and what they will teach about homosexual behavior, and when they'll teach these things and how. Will they provide students with contact information for service providers, the quotations around service once again. And then there's recommendations for parishes that you can either bring to your local parish and ask if it'd be incorporated into some of the programs there, or you could just recommend to your parish priest or pastor. To notify parents annually as to the contents of the frameworks, Maria talks, and the practices of the school-based health centers. So it should be at least once a year thing from the parishes to notify parents who have children in public schools. Through a letter, the brochure, bulletin notice, DVD, basically to get the word out there. Okay, and encourage dialogue with the schools. Encourage involvement in the political process to ensure quality abstinence programs and the rights of parents, because that's what we're talking about here. The rights of parents are slowly but surely disappearing when it comes to the public schools. Is when you drop your kid off at that door, your rights are essentially being in question. Okay, so we need to strengthen instruction for middle and high school students in the teachings of the faith with respect to sexuality and respect for life. Once again, missing in the sexuality education programs anything on fetal development, so we need to teach more, make sure that on the parish level that we have these pro-life and programs available. And integrate elements of successful secular abstinence programs, and there are some out there that we could refer you to. Okay, and homiletic material related to marriage, respect for life. And there's certain times of the year where I think that homiletic material on these topics would be, flow very nicely with what is happening in the liturgical year. So, so this is obviously something that we'd like to see your pastor or priest buy into. And prayers for vocations to sacramental marriage. And prayer, as always, is one of the most important things that we can do. And so we need to pray not only for vocations to priesthood, we need to pray for vocations for marriage. And once again, back to the prayer and the rights and a quote from Pope Blessed John Paul II. The rights of parents to choose an education in conformity with their religious faith must be absolutely guaranteed.
Why don't you leave that up for a second? It's the last slide. Okay, the dynamic duo. Stay up here, don't pull away. Time for questions and conversation. This is the short version of really what's a full hour-long talk. There's a lot more information that's available on true abstinence education and how effective it is. So if any of you would like a full presentation at a parish or church group, and for those who are of a different denomination, I originally put this together for Catholic groups, so you know, I think this is applicable to all religious traditions, even though it looks it's a little bit Catholic because I originally presented it that way. But we will speak to any group that needs more information on this. My biggest fear is the wellness, because that's going to erase parents' rights. Right now you can opt your child out if you don't like what's going on, right? But if we lose on that, you know, if it becomes wellness, you know, all rights of parents are going to be off the table.
At what point is that wellness? Is it going through committees now?
Right now, they're revamping the frameworks. We've been trying to find out at what stage that's in, but some schools have just, Westboro High has just gone ahead and done it anyway. You know, that Sally's lesson, you know, that was one of 6, and like I said, it was on exercise and nutrition.
There are a few school districts that have it now. I know Lexington does. And they're just incorporating these wellness programs right into their curriculum.
So parents are the big losers in all of this. I've never seen such, you know, I was a public school teacher for 34 years in Boston, and, you know, parents entrusted their most priceless thing, their children, to me. And this isn't betrayal. This is teaching kids how to sneak behind their parents' backs.
When can the schools just incorporate wellness without it being authorized by the state?
Yeah, if somebody pushes for it, they can do it, but my suspicion is that the state is going to push for the transition to wellness programs.
Who sponsored the bill to get this push?
The big sponsor of the frameworks is Alice Wolf. She introduces the legislation. But if you go to the website for Mass Catholic Conference, I think you could find the list
Right.
of the sponsors of the frameworks legislation.
So it's www.macatholic.org.
We're going to give you a brochure in a minute.
Okay.
I just wanted to make a comment. Excuse me. It seems like minors are not allowed to buy cigarettes, but they're allowed to get an abortion.
Yeah.
I find that ironic.
Or get free contraceptions?
Yeah.
When will this start? I mean, does it start in the grammar schools? I have a granddaughter in grammar school. When does all this start?
It could start as early as kindergarten and pre-kindergarten with those defining the gay orientation.
But is it now? What's happening now?
You would probably have to make an inquiry to a particular public school. I have a friend who lived in Duxbury, and her either first or second grader was given sort of a diagram and asked to name specific sexual parts of the body in a diagram. I mean, it's sexualizing. Some schools will do, you know, that's what it says in the frameworks. And if they teach health in the second grade and sexuality is part of it, then the kids are going to be labeling diagrams of the reproductive parts of the body.
I'd like to give a DVD to my local pastor. You said there was a DVD up there.
Well, what we can do, maybe we can kind of give these out. I don't know how many of you seen this. This is sort of an introductory brochure on the framework, so if you haven't seen this, you can give this to a pastor. Kathy and/or I would be willing to come out and do the full presentation. I feel like Kevin Costner in Field of Dreams. If you put it together, we will come. Okay, so why don't you kind of give those out? Yep.
How can parents influence this wellness program that is going to be?
Basically, what I think has to happen, first of all, in the fall, we're hoping that the bishops will send a letter to Catholic pastors and/or DREs so that they will know generally what these things are about. But I think it's going to take Kathy and I going from village to village and town to town and explaining to people the frameworks are coming, the frameworks are coming, you know?
Well, when the framework everybody come out though, Linda, it was quite a couple of years ago when they started talking about it.
But they're not mandatory right now.
That's right.
That's the
They're not
problem,
mandatory.
but they're trying to make them mandatory. But nevertheless, 90% of schools seem to be,
They are
anywhere between 3/4 and 90% in varying degrees are doing these controversial things with kids. So, in the packet, tried to give you some practical things. There's a cover letter. I would be willing to come out and do some programs. The other thing is to make sure in your parish or church community that the kids do get fetal development so that they understand what the abortion issue is really all about. So I did enclose a letter. I have 4 programs that I do. One on Respect for Life. Excuse me. The second I call the Vocation of Love. I don't know if I have enough of these.
We didn't get that last
Did you
hand
get that?
over here.
Okay.
Okay. If you're here